Hello, everybody. We are going to be presenting today on spinal muscular atrophy, or SMA, and the challenges and treatments associated with it. This presentation was done by Addison, Adrian, Michael, Natalie, and myself, Yesenia. We're going to be starting off with the video on Evelyn's story. And this is a pretty unique story because she has SMA type 1, and typically these patients do not live past 2 years. And Evelyn is now 4 years and a half, because she was able to get this new modern gene therapy. So we'll learn a little bit more about her story. So what is SMA? SMA is spinal muscular atrophy, and it's the term used to refer to a group of hereditary diseases which affect motor neurons and causes progressive muscle atrophy and weakness. The etiology and incidence. It is an autosomal recessive disorder, which means that the affected person has two mutated genes, inheriting one faulty gene from each parent. Carriers that only have one mutated gene, like the parents, do not express the symptoms. SMA can also arise sporadically, but that is extremely rare. And the incidence or prevalence is 1 in 10,000 births worldwide. It is twice as common in white and Asian population than Hispanic and Black. And it is caused by a mutation in the survival motor neuron gene 1, or abbreviated SMN1. That mutation causes low levels of SMN protein, which is vital to maintain the health and normal function of motor neurons. Insufficient levels of SMN protein leads to loss of motor neurons in the spinal cord and causes weakness and shrinking of the skeletal muscles. SMA affects specifically lower motor neurons in the spinal cord in the anterior horn cells, which we know are responsible for controlling muscle movement. And then SMA is the second most common severe hereditary disease of infancy after cystic fibrosis.
All right, so symptoms that kids with SMA usually present with include muscle weakness. This is typically in proximal muscles, so the chest, the shoulders, hips, thighs, and upper back are usually the most affected points. Cognitive function is often not impaired, and the diaphragm also isn't too impaired. However, sometimes the diaphragm is impaired, so that'll lead to further respiratory complications. The sensory nerves remain intact. This is a slow progressive disease, so as time passes, they'll get weaker and weaker, and this is because of the increased loss of motor neurons. All right, so SMA types. Type 1 is a very rare but very severe type of SMA. Symptoms usually kick in right at birth, so they'll have difficulty breathing and feeding, and this can result in them dying, again, right when they're born or shortly after. Type 1 is the most common type, and this accounts for 60% of all SMA cases. 6 months of age is whenever symptoms really start to appear, so this will be severe muscle weakness, trouble breathing, coughing, swallowing. The life expectancy for someone diagnosed with type 1 SMA is 2 years of age. Type 2 usually presents with symptoms around 6 to 18 months. They're unable to walk or stand without help, and sitting without support is extremely difficult. The life expectancy for someone with type 2 would be 20 to 40 years of age. Type 3 SMA is the type that we'll be focusing on for our presentation, and symptoms usually appear after 18 months of age. So the kid may have started to develop typically, but then they start to decline as far as their function goes due to the progressive disease that SMA is. So they'll have difficulty walking, running, and with functional activities such as going from sit to stand or climbing stairs. Type 4. This develops after 18 years of age, and this is another rare form of SMA. So the symptoms for this one are milder than some of the other symptoms are. So leg muscle weakness is the primary complication that people with type 4 SMA have.
Let's now look at the modern treatment on prognosis for SMA. Even though there is no cure, early diagnosis greatly increases the chance of a favorable outcome for the child. The goal of treatment is to allow the child to live a fulfilling life for as long as possible. There are targeted therapies such as gene therapy that can also greatly increase the chances of a favorable outcome for the child. They have genes that replace the SMN1 defective gene with a functional copy. One-time gene therapy for patients under 2 years of age is how it is conducted, and studies have shown that life may be prolonged up to 7.5 years longer after the therapy.
So we've talked about what SMA is, the types of SMA, symptoms, and the etiology. So I'm just going to talk to you a little bit about the impairments, and then we'll also talk about some stretching exercises that we can do to help with those impairments. So kids with type 1 SMA typically have the following impairments. One would be scoliosis. We work a lot with addressing that, more so in the sense that we try to preserve what they already have. We can't necessarily fix the scoliosis, so we will typically put them in types of braces that Drew mentioned during his guest lecture. And I believe there's some pictures later on in the slides about what that may look like. We also deal with postural weakness with this condition. They are prone to developing contractures. They have hypotonia. They are also prone to a lot of respiratory infections, so we have to just keep an eye on that. And then along with that, they may have abnormal breathing and difficulty swallowing. So we do see this, and then we work with what we can with this condition. All right, so moving on to the stretching portion. We incorporate stretching in HEPs, in parent/caregiver education, because it's really important to do the stretching. Also like to do the stretching before the exercises, just to get them moving a little bit more efficiently. And we also want to prevent the joint contractures, to maximize their moving, and to reduce pain as well. So it's very, very important for this condition to do the stretching. So some of the stretches that you might see with this condition is we'd want to stretch out their hip flexors. So you might see the modified Thomas test. We want to stretch out their hamstrings. We want to stretch out their pecs. So you might see like the I's, Y's, and T's type of stretching exercises for pecs. So a couple of things to note here is that with non-sitters, the stretching should occur about 5 to 7 days per week. Again, these kiddos, they have a lot of pain with this condition, so you want to do it as much as the kid can tolerate to do during the week. With sitters, you want to stretch about 5 to 7 days per week as well. Supported standing should be done for an hour or more, again, as much as the kid can tolerate. And then for walkers, stretching should occur about 3 to 5 days per week.
Now, applying proper strengthening exercises for the SMA population is very important to maximize their function, reduce risk of injury, and improve their overall cardiopulmonary health. Now, these tasks can be done through weight-bearing exercises, through proximal strengthening exercises, various types of different therapies such as aquatic therapy, and overall gait training for those who can ambulate. Now, positioning and maintaining the range of motion is very important in this population. It really goes for any population, but specifically for SMA. By holding these positions for as long as they can, this can improve their functionality and overall their quality of life. Now, this can be done through various developmental exercises, also through tummy time or keeping them in prone to really work on those extension patterns. We can also focus on head control, trunk control, and different trunk rotations to work on that disassociation. We can work on quadruped and positioning them in supine, either whether it be a towel or a wedge to assist with that. And then also different various standing programs can be used. And lastly, we have orthotics, splints, and braces. Now, splints and braces may help the child with SMA in regards of scoliosis by promoting upright posture and protecting their joints. Now, this is not a permanent fix, it's only temporary, as it only slows down the progression of the curve and promotes efficient breathing. However, this is very beneficial for the child.
When Major was diagnosed with spinal muscular atrophy, it came out of nowhere. We didn't know where to look. We never heard of it, but apparently we were both carriers of the gene. We found that out after the fact, and we passed it on to Major. We noticed a few things that he does that normal children don't really do. He's a lot more floppy. He has something called hypotonia, that's what it's saying. But it's been a process. We've only been able to get through this with each other's support.
And thankfully, thanks to PT, we've been able to see some real progress with his strength and stuff.
100%. So we're definitely looking forward to continuing the process of therapy. Hopefully we can grow to understand it a little bit more. But yeah, we're just leaning on each other for now.
We're very thankful for this process. It's been a learning process, but
it has.
It's been good.
All right, so yeah, we met Major's parents a while back, and it wasn't for, spinal muscular atrophy at first. They came to us because they noticed that their son started regressing in his developmental skills. So he did walk normally at first. He was already actually starting to climb up the stairs and down. He was about 18 months.
Yeah, I'd say.
So they were concerned, and it wasn't until we encouraged them to do genetic testing or to see, to go see a neurologist to see what exactly was going on with him, because he just kept declining despite PT. He started, they noticed him getting more fatigue with walking and things like that. So that's when they found out that he had SMA type 3, which is usually, around 18 months when you start seeing the symptoms. And it's more, there's 5 types, 0 through 4. But this is more of a moderate type. So we're still able to, hopefully, with PT, improve his quality of life, get him back to walking. He might need assistive devices at first. I know he recently developed some respiratory problems though. So. Yeah, so.
And a lot of other things, he's very hypotonic and has a lot of muscle weakness and atrophy. So our main focus is going to be on stretching, making sure that he's not as tight and able to be more mobile. We're going to focus on a lot more strengthening, really focusing on his reaching capabilities. We'll be applying a lot of resistance sort of training. That way he's able to strengthen the muscles that are weak. His core is also not as strong. We'll be working a lot of proximal stability exercises And lastly, just function. So he was previously able to roll well, he was able to walk well, and with that being on a decline, we don't want to lose all that. So we'll be focusing a lot of rolling tasks, working on some trunk movements, and overall get him back up to speed.
Wow, good job. So strong. Thank you.
Appreciate it.
Good morning, y'all. How are y'all?
Doing good. How are you?
I'm good too. I noticed you're a little out of breath. What happened today with Major's wheelchair?
Medicaid still hasn't sent it in. Yep, we're still waiting on it.
That's so frustrating. I'm sorry to hear that.
Thank you.
I'll try to make a referral to speed that process up.
Okay.
That'd be awesome.
After the treatment session, okay?
Thank you.
All right. So today we're going to start off with some stretching. You excited for today's treatment session, Major?
Yeah.
How you feeling today?
Okay.
Okay. Well, at home, it's important to stretch every day, because with his condition, his disease, it is easy to form contractures. So like those muscles to get tight as they get weaker. So we want to be stretching those muscles that are close to his trunk. So like his hips, his shoulders, his chest. And I'll show you a few stretches today that I can practice at home, okay?
Okay.
But I was actually, you like Gracie's corner, right?
Yeah.
You like counting?
Yeah.
We're gonna do some counting first, okay? Before we get to playing, okay?
Okay.
He loves Gracie's corner.
Yeah.
You have to. Oh, that's so smart.
Yeah.
He loves the count too.
I've pulled out the counting video,
Okay.
and we wanna try to go for 30 seconds.
Okay.
But I'm gonna actually move to that side.
You ready to count,
All right, Major.
Yeah.
You go ahead. All right. So the first one is going to be, you can have this like this, and then you can do this at your bed, or if you have like a sturdy table at home too.
Okay.
All right, we're gonna count to 30, okay?
Okay.
Drop this foot off this way, and you should feel the stretch right here. 1. Count with me, Major.
2, 3, 4,
Good job, Major.
7,
Oh, we skipped one, but
10,
Not cheating.
33,
All
17,
right, let's see what the song says. 9.
Nice.
Okay.
9, 9, 9,
he has a favorite number.
Yeah.
Nine.
Okay. So
Keep
it's
that.
9.
9,
All right. So we're just gonna fast forward that.
Good job, Major. You did
Yeah.
so good with that.
Yay.
All right. So any of y'all want to try that stretch right
I'll
here?
try this one out.
If you have any questions, just don't hesitate to ask.
So we bring his leg out
Yes.
like that.
And you just want to make sure he's at the edge of the table,
Okay.
and that his leg is able to like, basically that gravity is holding his leg down for that stretch.
Okay. Is this position good though?
Yeah, that's okay.
Okay.
And then try to hold that, or try to make him engage in that position for 30 seconds.
All right. Let's count again at Gracie's corner.
Okay.
What number we at? 20.
21.
Yeah.
He's good at 21.
22. Yeah.
You know, you're great at counting.
24.
We just have some issues getting past 10.
Yeah.
Yeah. 9 is his favorite number, so.
Well, you know, just like a song would make him engage.
Yeah.
Or anything else, like maybe watching TV or something like that. All right, so the next stretch we're going to be doing is for his chest muscles.
Mhm.
All right, those are very important because those are very easily, you know, become weak and tight. So we're gonna do a stretch, okay? The next stretch are gonna be for here. for your chest.
He really does like Batman too, so.
Yeah?
Yeah.
Alright, we're gonna pretend you're spreading out your wings. So your hands like if you're Batman. Wow, look at that.
Good job, Major.
Look at him go.
We're gonna hold here for 30 seconds, okay?
Okay, you ready to count again?
Yeah.
Okay, let's count.
3. And right now he's doing a really great job. Very great job, Major. But at home, like you can always stabilize here and then hold his hand down or do one hand at a time.
You can do it. Stay still, Major. Stay still. Yeah. Oh, here's your favorite. 10.
10.
Finally made it.
Can you help us count, Major?
12.
Good job.
13. 18.
Oh, that was close.
Yeah.
16. 17. 18.
There we go. Great job.
19.
You're my best behaved patient today.
Yeah. That's so good.
He is. He's really good.
Yeah, he's well behaved.
Daddy beat me, I'm not good.
What do you think? That's not true.
No.
That's not true. You're
Oh,
not good, right? Kids just talk. Kids love to talk.
Yeah.
Just make up anything. Good job, Major. You made it.
Alright.
Good job.
Alright, do one of y'all want to try out that stretch? You want to try it
Sure,
out?
yeah. So he just brings his arms out to the side, and anytime he wants to do it, so he can do it like Batman.
Yes, like Batman or like any reference you think that would engage and just
Okay.
stay
And
there.
then we'll just do like the count.
Yes.
Nice. Good job, Major.
Alright, y'all have any questions for me for this part of the treatment? No? Alright, sounds good. Alright, okay. We'll go ahead and move on to the next. Good job, Major.
All right. So the next thing we're going to do is work on like a sitting balance activity. I'm going to put her into a functional position. We call it ring sitting. When anytime she needs to like work on this sitting balance, this is like a position that's easy for her to get into.
Okay.
So what we're going to do is work on picking your foot up, putting it right here on the table, and we're going to do the same thing with this foot. Okay? I see you found a little toy there, didn't you? So I'm glad you actually found that. Does Dad want to come around and try to get her to reach for the toy?
Yeah.
So
Can I see this?
it doesn't have to be a lightsaber. I don't know if you have one of those at home. We have that in our clinic. One of our staff members donated that to us, so we're very grateful for that.
Okay.
But anything that gets her to engage with the activity. So,
Roger loves swords.
Yeah.
So, yeah.
So as
She'll
you
reach for it all the time.
Exactly.
Yeah.
So as you can see right now, she's using her hands to sort of support herself.
Okay.
But what we want to do is slowly take away her base of support, so we can really focus on strengthening her postural muscles, getting her to sit up nice and tall. So
It doesn't hurt her to sit like this, right?
no, it doesn't really hurt her to sit like this. There is a bad way of sitting. I'll show you that later. It's called W sitting. But this is actually a pretty good position for kids to be sitting in.
Okay.
So do you want to try and
Roger, come on.
try and reach for it? I think it lights up too. Oh,
Whoa.
she got it.
Roger.
So you gotta make it a little harder. She took it away from you too quick.
Yeah, she's good.
Do you want to pass it back to Daddy?
No.
You don't? Okay, well, if you want to win again, you're going to have to pass it back to Daddy.
Come on. Come on. There you go. All right, you got this. Ready? It's right here.
Reach for it, Major.
You
got
got
it,
it, Major.
Come on.
You got it.
Come on, Major.
Good
Wow.
job. And I want you to also, great job. Look at where my hand position is. So I have one hand back here on her pelvis, and then one hand up here on her shoulder, just so I can sort of give her a little bit more support when she needs it, and I can also like slow her down if she needs to slow down a little bit, or Major needs to slow down.
Awesome. Very cool.
All right.
When do you recommend would be the best time to do it?
I would actually work on strengthening after stretching. So
Okay.
if you want to just find a nice time of the day whenever she's already had her stretch, and then just sort of incorporate this activity into it, I think that'd be a great option.
Sweet.
Very cool. Okay.
Yeah, thank you. And so do you want to stand right there and try it? You can.
We can do it from the back too.
You can, but I just make sure that somebody's in the front.
Okay.
Just to make sure that she's.
Just kind of where your hands are right now?
Yeah.
Okay.
So you got one hand there, one hand there, and then.
Look at the lightsaber.
You go get it. Come on.
Wow.
I know you
You
love
got
big.
it.
Yeah. That's right.
Good job, Major. Y'all have any questions for me?
No, not really. That's pretty cool.
Yeah.
Well, glad to help. Alright, so for this next exercise, we're going to work on Major's sitting balance. The first thing I want to do is get Major into a better position to actually do this activity in. It's something we call ring sitting. So can you scoot back just a little bit for me, Major? Just come on back here. Good job.
Good job, Major.
Yeah.
And what we're going to do is bring both of your legs up. So put that foot there and do the same thing. Oh, you catch on quick.
Why can't you do this at home, Major?
Good job. All right, so this is a pretty good activity, just so Major can start to challenge the core strength, get a lot of postural stability. What's that we have over there, Major?
No
Major's
way, Major.
favorite. Look.
I know you love
Major,
Star
it's
Wars.
blue.
Look at that, and you're already doing a good job. So that's the idea behind this activity is that
Okay.
Major starts to reach outside of the base of support, and we're really challenging the muscles whenever Major does that. So as you can see, I have one hand right here on the pelvis.
Okay.
So it's sort of right here at the hip, this hip bone right here. And then this hand right now is kind of stopping motion from this side. So really encouraging Major to reach with that left hand.
Okay.
Now, if Major was struggling with that, then I could also offer a little bit more assistance with the activity, or if Major was going to go too far, I could always use my hand to bring Major back. Right? So do you want to try that reaching activity again? Maybe over here with
Come on, Major.
Dad.
Can I see it really quick? I'll give it back, I promise.
That's right.
All right, Major, ready?
Reach,
got it.
Major. Reach, Major.
Oh, man, it's
You almost got it. You almost
Use
got
the
it.
force, Major. Come on. We
job.
practiced this at home.
Oh, Dad's making
Come
it
on,
hard for
Major.
you.
Oh!
Nice. Good job, Major.
That's my Major.
It is your Major. Do you want to try it out just for hand positioning?
I'd
Just to see
love
what it
to.
should be?
So you said just keep one hand on the shoulder, in front or behind it.
It can be in front if you feel like Major's starting to go a little bit too far. Just reach around to the front part of the shoulder to bring Major back.
And you said just on the back like this?
Yep, right there at that little hip bone. Right. So that's awesome.
Like this, okay.
Yep, looks good.
All right, Major.
You want to high five me for doing a good job?
Come on, Major, you got it.
Awesome. Good job. Any questions for me?
No, that's really good.
All right, so you know how we worked on some stretching to get him a little bit more warmed up, and we did some sitting stuff. So we're gonna be maintaining that same position. So this is called a ring sit again.
Okay.
He'll be in this position, and this time, instead of him just reaching and working on that balance, we're doing it for strength. So I'm gonna have him reach over to Dad here first. So what we wanna do is from whatever side he's reaching, we wanna put our hand on the opposite hip.
Okay.
So we're gonna put it here. We're gonna put it here. And then since he'll be reaching to his right, we're gonna put that hand, the other hand on that side that he's gonna be reaching to.
Gotcha.
All right, that's, I'm gonna give this to you.
Okay.
Look at that, Major. What is
Come on,
that?
Major. You can do
The
it.
saver. Go ahead, reach for it.
Come on,
reach,
you got it.
reach,
Look, it's blue. It's blue. Come on.
reach for it, Major.
You know what's gonna happen. Good job,
Good
Major.
job, Major.
Yeah.
Okay, do you want to get on the other side? Have him reach that
Sure.
way?
Sure.
Come on, Major. You got this. You got this, Major.
All right, so again,
All right.
opposite hand on the opposite hip.
All right.
And
Come
then-
on, son. Reach for it.
There
Come
you
on.
go. There you
Come
go.
on.
Go ahead, Major.
Come on. There we
Yeah.
go.
Good job.
There we go.
Since I have you here, do you want to try it?
Yeah, let's give it a shot.
All right.
All right, where do you want to reach to, Major? Where do you want to reach?
Okay,
that her?
let's reach this
Okay.
way.
Okay, we'll talk about this later, okay?
Opposite
All right,
hand.
you got this,
Good.
Major. Come on.
Come on, Major.
Come on,
Reach.
give it to her. Come on, reach.
Good
Yeah.
job. Another key thing to note here is that with this hand, when he's reaching, make sure you're pulling it back to provide some resistance there.
Okay, make it a little more difficult.
Yes.
Let me see what we got.
Yeah, you got this, come on. You show my stuff.
You got this, Major. You
All right.
got this.
All right. Which way you reach?
This way. Let's reach this way.
Come on, Major.
You got it, Major.
All right. Go ahead. Reach.
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 Come on, Major.
Reach. Reach.
Good job,
Good job.
Major.
That's yours now, okay? That's yours, Major.
Good job, boy.
Any questions for me on the activity we did?
Is there anything that we should look to avoid while he's doing this?
So if he starts tipping over too much, just make sure that you're really holding down here and stabilizing it. That way he's not leaning too much towards one side or the other.
Perfect.
And then, like I said, whichever side he's reaching to, you want to make sure you're pressing down and back to really provide that resistance for him.
Perfect.
All right, and ideally you want to do this after like stretching. That way he's a little bit more warmed up.
Okay.
All right, good job today, Major.
Good work. Good work, Major. Now we are going to work on rolling, all right? So going from laying on his back to being on his stomach, okay? That's gonna help him functionally. So Mom, if I can get you to grab the lightsaber and go ahead and stand on that side of him.
Lightsaber.
Now, when we are having him roll, you want to be on the side that he is rolling to, okay?
Okay.
So what we're gonna do, we're gonna get his attention with the lightsaber. Come on, Major, go ahead and reach for the lightsaber. So we're going to provide facilitation here at the shoulder, get him turned, and then also at the hips.
Come on, Major.
To go ahead and help him roll over so that he is on his stomach, all right? So now I'm gonna let you all practice. So we're gonna roll him back over. So we can come to the opposite side and then just facilitate roll, let him roll towards you. All right? So now let's go ahead and try. Mom, would you like to try first?
Okay, yeah. Go ahead, give me that, sweetie. We'll get it back in a little bit, okay?
Perfect.
Come on, you reached it once. Come on.
Yep.
Come
Good.
on, you got it.
Good.
Reach.
Shoulder.
Reach.
Good. Good job. Now, something that you do want to focus on, we want to separate his upper body from his lower body. So I would provide facilitation at the shoulder first to go ahead and get his trunks to move, and then bring those hips with it, all right? Oh, are you trying to hit me, Major?
No, Major, be nice.
Do you see your parents hit like that?
Be nice.
Okay. All right, so did you all have any questions for me?
No.
All right, so you want to make sure that you are doing all of these exercises and interventions on a daily basis. Before I forget, Major looks different. Is there something different about him today?
We just changed his shirt.
Change his shirt,
Yeah.
okay. All right, well, hopefully you all could hear me during this. I know we're right near this train station and it's super loud, but definitely feel free to reach out to us if you all have any questions. But if not, we will see you at our next session.
Okay, thank you.
Good morning,
Addison, bro. Dude.
Pretty cool.
Yeah. All right, so you know how we worked on Major sitting balance? So now,
I can't sit like this.
yes. All right. Okay, so next what we're gonna do. Go.
Whole life is he's a little floppy. They called it hyper. Honey, do you remember what the word was? It was
Hypotonia.
that's what it was. It was
That's-
hypotonia. Yeah. So we're just looking for answers. We're just looking for answers.
Whenever y'all are ready.
Okay. Big because of I think us staying together,
Yeah.
supporting one another.
And thankfully to PT as well.
All right, whenever y'all are ready.
When our son was diagnosed with spinal muscular atrophy, it's like we were hit by a train. We didn't know where to look. We didn't know where to start.
All right, so yeah, Major, he came to us, his parents came to us.
Not a word.
I'm get it. Maybe I just had to get it out. What is going on?
What's happening? What is this scene?